I would knock and I would provide my hand hygiene. Hi, my name is Taylor. I'm going to be your student nurse today. How are you doing?
I'm doing good.
Okay, so today I just wanted to talk to you about pressure ulcers and how whenever you're going into surgery and stuff like that, they can actually get worse. So basically, pressure ulcers are just this whenever your skin decides to break down. This mostly happens on your elbows, on the bottom of your heels. It could happen on your hips. It could really happen anywhere that has a lot of pressure on it and it's constantly getting rubbed onto a bed, operating room bed, anything like that. Before people go into surgery, a lot of the times they would do a skin assessment on them just to kind of see like if they've had any history with any ulcers, if they already have red marks. If they're a bed-bound patient and they've already been sitting a lot, then that will drastically increase it.
Right.
Surgeries can go from anywhere from 2 hours to 24 hours. So whenever you know that a pressure ulcer can be created and be formed in 48 to 72 hours, you kind of think, oh, well, 24 hours isn't really going to do much. But it's not only in the operating room, it's after the operating room too. So normally after surgery, you're not going to be up running a marathon or anything like that. You are going to pretty much be not bedbound, but you're going to be low ambulation, like low moving around and stuff like that. So before the surgery, they will kind of give you the skin assessment. They'll check all your bony prominences, that's like your ankles and stuff like that, and they will add foam to it. You might see it a lot like in the actual hospital. If you ever see someone that has foam or maybe even a pillow or anything like that, just to decrease the amount of pressure that's being on that one spot. During surgery, they normally put you in one position the whole time because they don't want to risk, you bleeding out or organs getting moved around or anything like that, or even you just falling off the table. So normally they'll keep you laying down, sitting up, whatever they have to do, and that could really make this worse. So whenever we started all these practices, like the skin assessment before and after, when we started implementing the foam and stuff like that, I think it was around 4,500 patients that they implemented all this stuff on. Only 8 of them got pressure ulcers. So that really goes to tell you that this stuff helps long term. So now that I've kind of taught you a little bit about pressure ulcers, can you kind of teach me about them?
Yes. So a pressure ulcer is prolonged exposure to one site. So there's constant pressure in one specific spot and it causes the skin to break down.
Yes.
Right. And then when they implemented coverings, like foam coverings over your heels, there's egg crate beds, I've heard of that, where
Okay.
they have soft beds so that you don't have skin breakdown.
Okay. And do you think personally that with the stats I told you and how it's helping and all that, do you think that it would be something to implement in the future, or do you think that it's just like we did it, we found out that it works, or maybe you don't think it works? Do you personally think that it works with all the stuff that I've given you?
Yes.
So what are some things that you would do differently if you were going into surgery and then you were coming out?
I would check my own self. I would
Mhm.
look on my body in the areas that I can see if there's any red marks or any possible skin decay before I even go in the operation room. I would notify my provider or the person that's going to be operating on me, the surgeon, and let them know that I have some blanchable spots.
Yeah. And then after surgery, let's say you were told that you had to be in the bed for 4 days after surgery. You could only get up to do like necessary things. What would you use at home that could help you?
I'm not really sure. Can you tell me?
Yeah, you would put the pillows under your legs and all that. You could change your position easier. You could, maybe you would need someone to help you change your position.
Like rotating myself?
Yeah, that'd be perfect. Pillows are really good, honestly. You can just take a pillow and kind of bunch it up or whatever and just put it under your heel or put it under your elbows so that you're not having constant pressure on them.
Okay.
You have any questions?
I do not.
Okay, I'm going to leave the room. I'll come back here in a little bit and I will check on you, and I'm going to do my hand hygiene.
Okay.
Bye.
Bye.